and kick it off, and I think we'll do that. Good morning, everyone. And we know that we'll have people add in and join us midway. We also will be recording this, and we will post it on our YouTube, most likely, and we'll give you that link. So, good morning. My name's Dee Dee Montgomery, and on behalf of the Oregon Institute of Occupational Health Sciences and the Oregon Healthy Workforce Center, we welcome you to this first COVID conversation. This is a series, we hope, if it's popular enough, of chats, and it is supported by our local professional associations, including the Oregon State Association of Occupational Health Nurses, ASSP, Columbia Willamette Chapter, and the Portland Local Education Committee of Pacific Northwest section of AIHA. If you are not a speaker, so if you're not Joel or Kate, we would ask you to mute yourself and turn your video off to protect bandwidth. But we will encourage you to chat. So you'll see a chat option at the lower navigation bar. And we'll encourage you to share ideas amongst yourselves if you'd like, but also to share questions that you may have. And we'll get to as many of those as possible. And then the plan here is I'm about to introduce Kate. Kate will introduce Joel, and we'll kick it off for about 20 minutes of conversation with a few minutes for questions. So again, thank you for coming. And if you have any technical issues, you can privately chat myself. Again, last kind of request to turn your video off and to mute yourself if you are not Kate or Joel. And on that note, I welcome Kate Wood. Kate is a board member of the Oregon State Association of Occupational Health Nurses. And take it over, Kate.
Thanks very much, Dee Dee. Really appreciate your technical support and the support of Oregon Health Sciences and the Healthy Work Center. I want to welcome Joel Michaels, who is a nurse practitioner and the manager of the City of Portland, Oregon's Occupational Health and Wellbeing Program. And Joel, I hope your shoulder has recovered from the arm twisting that I had to do to get you to agree to be our first guest with this experiment. But you know, when you politely declined my request to be our first speaker, you sent me an email explaining why you couldn't possibly do it. And now when I read it, I said, oh, I'm going to use his own words against him, because this is exactly the type of thing that I was interested in learning about. You wrote to me and you said, right now I'm overwhelmed with work, as you can imagine. Between COVID and OSHA policy and procedure updates, labor negotiations over any changes, case tracking and reporting, and an intern I'm bringing on board, ongoing wellness, hepatitis vaccine initiatives, writing a grant with an approaching deadline, my plate is fast full. And I thought, wow, those are not usually the roles people would imagine an occupational health nurse might have. And I was wondering then, are those new roles for you because of COVID? Are they expanded roles because of COVID? What's going on in your practice at the city?
Well, first of all, thank you for having me and for hosting this event. And I certainly look forward to hearing the conversations in the weeks to come from other folks about how COVID is affecting your work and the safety at your workplace. COVID has really changed everything, right? This is a crazy time that we're all going through. Work and life have really taken a turn over this last year. And my work has changed dramatically. Yeah, so some of those things you mentioned are definitely new. The city of Portland, I just want to start by saying the city of Portland never closed. We have about 60% of our workforce that's able to work from home, but 40% are essential frontline and critical infrastructure workers, folks like first responders and water and wastewater treatment, transportation, maintenance folks that still report to work every day. So as this pandemic started, the work of occupational health really became more about safety and less about dealing with healthcare, as we looked at how do we keep these people safe and what protections can we put in place? How do we address when somebody is sick and can't come to work? How do we exclude people from work who may be infected with COVID? And really, as the city's ECC or Emergency Coordination Center was activated, a lot of what I did was support the safety officers and the HR department in writing policies and procedures to help keep people safe. That work has transitioned into me being part of the ECC. I'm one of the safety officers. I share the position with 4 other folks from the risk department. And what we do is just address safety on a day-to-day basis. A lot of the questions that we get are around what to do in different scenarios with people who are sick or can't make it into work. And a lot of the answers to those questions really set the foundation for adapting well to the Oregon OSHA standard, the temporary standard that just came out recently. So our work shifted into adapting what policies we created to meet the requirements of OSHA as well. So I would say my work has expanded just in terms of being more focused upstream on how to keep people safe and how to keep people sane. You know, one of my hats is the occupational well-being program. Our workplace well-being program is called City Strong, and sort of adapting the program to meet the needs of folks that are now dealing with all of the stress that's going on with the pandemic, both the isolation, all the stressors from working from home, how you juggle your kids doing school from home, the financial stressors. The city, the non-represented staff had to take furloughs this last year, how to deal with all of the racial calls for racial justice, protests, the election. It's just been a really busy last year. We're coming up on a year now. So yeah.
So Joel, are you utilizing the city's EAP services for the employees? Are they still operational? Are they still available to provide services?
Yeah, absolutely. They have been able to tailor a lot of their content to managing pandemic, and we've definitely reminded folks on many occasions to utilize their services and reach out for help when it's needed. But a lot of what we've done is also kind of changed how we talk about wellness and we talk about safety now at every opportunity. A lot of work groups will bring it up. A lot of groups have a safety topic or a COVID topic that's integrated into each email communication or video meeting. And we take those opportunities to remind folks about what services are available, what sorts of town hall or group meetings that people can participate in to combat their social isolation from not being at work. We've also launched a couple movement challenges using a platform for people to try to stay active.
Has the city provided equipment for the stay-at-home employees? Were they able to get their chairs from the office and bring them home? Workstations?
Yeah, we've definitely made steps to support people working from home in terms of, you know, at first it was just the technology of how do you get people a token and get them a computer or a cell phone if they don't already have those. But then it's progressed into helping folks pay for an extra monitor, bringing home equipment from their desk, such as a scanner or chairs. So definitely trying to keep folks in good ergonomic and all the equipment they need to be able to do their work from home.
So for the employees that have to come in and do the maintenance types of work, which sort of is very similar to the challenges that construction companies have, how is that working? How are you involved? Are you working directly with the safety specialists in those bureaus, keeping people 6 feet apart, wearing masks?
So yeah, we rely on the Bureau's safety officers and managers to make sure that the guidance is being adhered to. That's been a real challenge in certain bureaus. One of the, we write the policies, we make sure that people have masks or face coverings, know what they're supposed to do to stay safe. But one of the biggest challenges is meeting people where they are in terms of how they accept the science or whether they accept the science, whether they feel compelled to take the recommendations. Been a challenge in some bureaus more than others. As you can imagine, politics, education level, these things can vary greatly from one work group to another. So it's important to provide rationale with when we provide policies or direction, and appeal to everybody's sense that we are looking out for each other and that we're in this together. I think those are important lessons that we've learned about the messaging. It's not enough to just tell people that they have to do something. You really have to explain to them what the science is and why, and how it not only protects them, but it protects everybody in the workplace. Just using discipline and kind of the stick approach has not been as successful as integrating that with some messaging that empowers people to make the right choice with information.
Well, in the public health arena, as you listen to the information that goes out, or if you're watching what the OHA is putting out, they talk about the trusted messenger. And it struck me as a health and safety professional in the workplace, we always had to be the trusted messenger. And that's a person who is part of the community, who is understood to have an understanding and special knowledge within that community, and is a person that is trusted by the community. So I'm wondering, as a nurse, as nurses, you and I have always had a special privilege that just comes along with that title, and people always often feel comfortable providing really very personal and intimate information. How do you see your background as a nurse or role as a nurse translating into how people perceive you as a trusted messenger in the workplace?
Well, nurses are uniquely positioned to do this, right? We are educators, we're advocates, and we have relationships with a lot of folks already. I mean, personally, I've worked with City of Portland employees since 2012. In my previous job before I came here, I was a healthcare advocate and case manager through Moda Health, one of the city's health plans, and worked with very sick and high utilizer City of Portland employees. So I sort of came to this job knowing a lot of folks on a real personal and trusting way. And the occupational health nurse role kind of lends itself to that. Our files are privacy protected. People know that their conversations with me are secure and private. And so I think the leaders in the various bureaus and citywide have tapped me as a trusted health source, and include me in some of the planning process, definitely include me in some of the messaging. Currently, I'm publishing an FAQ on vaccines to kind of address some of the vaccine hesitancy that we know is probably out there among employees, and really trying to just be as proactive and as honest with information as possible is really what we found to be the best strategy. But certainly using a trusted messenger, whether it is a trusted leader, somebody that from the HR bureau director or the CAO for the city, people have come to look to these leaders as well as being trusted sources of information.
And when you look at the total worker health model, which is one of the conceptual models that occupational health and safety practitioners are looking to utilize, it seems to me that the integration that you're talking about, that you as part of the ECC, as part of the sort of core planning group at the executive level, and then your ability to integrate with employees or safety managers directly. Would you say that these are new roles for you? Has COVID created them? And do you see them persisting into the future after we corral COVID? I mean, that's going to be the post-COVID world. Do we get it corralled? Do you see those relationships continuing and the total worker health model becoming more of a reality in the city?
Yeah, I definitely do think that this is the new normal of, we need to be proactively addressing health, safety, benefits, and, the worker experience. And this has just really brought those all together. One of my takeaways I wanted to mention today is how important that is to bring all of the right people into the discussion and into the planning and into the policy making process, because you need to have folks from the benefits team, from HR, from risk, from the legal team, from occupational health, and key players from within the target group that you're trying to address, because we need to look at all these things together. And if you try to look at them separately, you'll end up leaving somebody out. The equity and inclusion workers in the city are also really important to keep at the table, because it's easy to, forget that there's other perspectives from the 5 people that are sitting at a table trying to make policies and plans. So yeah, I think this has been for me, it's been great to get out of my occupational health bubble, where I often meet with patients one-to-one and am frequently out in the field. Maybe I'll teach a class, but this has now become more integrated with labor. I'm in labor negotiations to try to make sure that labor leaders are on board with our safety policies. And oftentimes they have really great suggestions, and they've heard from their members and are also strong advocates for safety, health, and wellness. So they're also really important to keep at the table. So just for me, the work with the safety officers that I meet with every week, it's just, for me, it's a much more fulfilling job now, knowing that I'm working with all these different groups and addressing people's health and safety in a more holistic way.
Okay. And we've got like 1 minute left before Dee Dee comes in with the hook. And so a quick lightning round. Some things I just wanted to ask you to put on your look to the future goggles, and understanding that in no way does this commit the city of Portland. This is just you as a professional, based on your experience, what you see coming at contact tracing in the workplace.
We're already there. We already do contact tracing. The county reaches out to me regularly to ask about somebody that may have been contagious at work. They're too overwhelmed right now to do contact tracing with everyone. So we've got that up. I've got people trained, from the safety officers or the safety professionals in all the bureaus to HR business partners and supervisors. So we're doing a good job with contact tracing right now.
Do you see COVID testing on site? The technology is changing. We're going to have a rapid COVID test pretty quickly here, I think, with a 95% reliability. Do you see COVID testing in the workplace?
I think if the reliability gets that high, we would definitely consider that. The antigen tests have been very unreliable up until now. We have done some PCR testing. I was able to test folks using my lab services. But we've currently got an arrangement with a healthcare provider to get people tested in a very convenient and timely manner when it's work related. So, certainly a rapid test would change things. So I'm still waiting to see the highly reliable antigen tests come out.
Okay. And again, a positive test would be personally identifiable health information. And so what do you do with that information becomes a challenge. And finally, we're a minute over here, but what do you see? The city of Portland provided seasonal flu shots on site for employees for 2 decades. Do you see, once we get a vaccine that's a single dose, doesn't require ultra cold chain storage and handling, do you see doing vaccination shots on site for the employees for COVID?
Well, I certainly hope that they're not necessary, that we all get our initial shots and they work forever and cover all the variants, and we put COVID in the rearview mirror. But I realize that that may not be the reality. So I think it remains to be seen whether we will need annual COVID shots to keep us up to date on the latest variants. But certainly that's a possibility, and we would just model it the way we do with our flu vaccine clinics, either using a vendor or me providing the services to smaller work groups.
Well, we are amazingly out of time. Dee Dee thought that she was going to have to come in and do a little song and dance to fill in, but I was really confident after I saw the things you were doing, Joel, the great work that you're doing for this city. I want to thank you, Joel Michaels, nurse practitioner, City of Portland, Oregon's Occupational Health and Employee Wellbeing Program Manager. I want to thank Kathy Bless, who is the city's HR director, for supporting your position and allowing you to be utilized in the most effective fashion. Now, I'm Kate Good. I'm a member of the Board of Directors of the Oregon State Association of Occupational Health Nurses, and I'm retired from paid employment. And so I'll turn it over to Dee Dee to do all the hard work now. Thanks, Dee Dee.
Thank you, Kate, and thank you, Joel. That was terrific. I think we got a couple of questions, and I'm going to say one thing and then turn it back to you. You spoke on both of them, but I'll share them in 1 second. Before I do, for those of you that joined, thank you all. As we mentioned, this was give it a shot, and we are going to schedule another one 2 weeks from today on February 23rd. Same idea, same format with a safety and health professional, and we are seeking that safety and health professional. So share your ideas to me on that. Joel, the two questions that we did receive, and again, you touched on them. One was, are you able or were you able to get adequate PPE? And the second one is, you spoke about vaccinations, but a kind of a follow-up to that is, if there was hesitancy or if there is hesitancy, do you have any tips about that? And I'll kind of leave you with those two thoughts.
So yes, the city does have adequate PPE. That was a problem initially, maybe 8 months ago. But we do have adequate PPE for folks and have that available. Some of that is coordinated through our ECC, but bureaus now have their own supplies to give workers. And then for vaccine hesitancy, that's an ongoing challenge. There's a lot of reasons why people are hesitant. There are some, racial history in this country where the vaccines were used experimentally on Black folks. And so there's obviously some mistrust that we need to overcome. I think just my way that I'm advising the city and what we're doing is just providing as much information as possible, providing a forum for people to ask the questions, and providing information, debunking conspiracies, teaching people how to find reliable sources to do their own research, and that the vaccine does not have a microchip implanted by Bill Gates, and even more realistic concerns that how safe is it, and what are the side effects and how likely am I to have those side effects. So really, we've got some time before we will be allowed to vaccinate our employees, or that they will be able to go find a vaccine. So we're taking that opportunity now, between now and then, to answer questions and proactively provide good information to folks.
That's really helpful, Joel, and I appreciate that. I think for those of you looking for more on vaccines, although there's lots within the state, obviously, CDC has in fact released quite a bit recently for toolkits for employers, and we'll put that into an email follow-up for all of you. I think maybe there is one last question, and we know some of you need to tune out, but Joel, there is another question, and that is, how is the city handling contractors? Do you want to speak to that, or can you speak to that?
So our expectation is that our contractors will help us do contact tracing, and we'll perform it themselves if we are not able to do it for them. But we expect contractors to abide by all of our workplace health and safety guidance. And some of that includes how we do contact tracing and how we keep sick people out of the workplace.
Thank you. And I think with that, we'll go ahead and give our goodbyes. But before I do, really terrific info today. Thank you for taking the time. I think for many of us, we can only imagine how overwhelming this has been to a city or municipality. And so thank you, Kate. Joel, wonderful. We will have the recording put together and we will email all of you who registered what that link is.
Thanks for having me.
Okay, thanks.
Thanks again.
Bye,
More
everyone.
coffee.